So, have any of you ever heard of a condition that is called recurrent corneal erosion? It is a very painful condition indeed. As the diagnosis name itself suggests, it means that it keeps recurring. It's recurrent. It is a condition where the cornea keeps peeling off. The cornea repeatedly peels off. Now, this patient underwent toric ICL implantation in both eyes 3 years ago, and then in December of 2024 developed recurrent corneal erosion in the left eye. Despite using protective contact lenses and eye drops, the condition keeps fluctuating, improving and worsening repeatedly. The vision isn't really bad, and the right eye is perfectly fine, but I suspect something must have definitely caused trauma at that time. Usually, it's from getting a paper cut on the eye, or perhaps rubbing the eye too hard, causing an injury. It can also be due to a congenital predisposition in some cases, you see. In such instances, it frequently manifests in both eyes, and it's also possible for it to occur following surgical procedures. There can be various factors involved, but when it suddenly appears after a long period, I believe it's more likely related to some kind of event that occurred then, rather than being due to the surgical procedure itself. So, in these cases, we need to carefully consider the surrounding conditions of the eye for treatment. Recurrent corneal erosion is a condition where the corneal epithelium repeatedly peels off due to friction. Essentially, the epithelium is the outermost layer on the surface of the cornea. It's supposed to be firmly attached to the underlying stroma, but in this condition, it is weakly attached. So, when this adhesion complex becomes damaged, because it's only weakly attached, the epithelium is a condition where it can easily peel off again when there's significant friction on the surface of the eye. So, fundamentally, since this condition arises from a weak attachment, we must either reinforce that bond or modify the environment to reduce friction in order to effectively prevent its recurrence. Well, in those kinds of situations, we typically utilize therapeutic contact lenses or perhaps a pressure bandage to provide immediate relief from the symptoms. If the epithelium is weak, there are treatments to peel off the weak epithelium to help it recover better, but most of these are temporary solutions. To prevent recurrence, procedures are often necessary. So, since the core issue is that the adhesion complex is damaged, what we need to do is actually restore that adhesion complex itself. One particular treatment involves puncturing the cornea using a needle. It might sound quite painful, but with the aid of anesthesia, you won't experience any pain. When we puncture the cornea with a very fine needle repeatedly, it scars and adheres firmly, and that's the property that we are utilizing for this treatment. Now for the very center of the cornea itself, using a needle is actually quite uncommon, as it can potentially result in a scar forming. So, because it could affect vision, in cases involving the periphery, we can prevent recurrence to some extent with stromal puncture. Now, what about a method that won't leave a scar? There's a laser method that can be used. By employing a YAG laser, we target the region situated between the epithelium and the stroma, applying the laser energy in that specific area to induce a controlled scarring process which facilitates strong adhesion as the tissue regenerates and heals. Indeed, compared to procedures like stromal puncture, this approach significantly reduces the risk of infection, allows for a consistent treatment depth, and notably, even in the central corneal area, it typically does not result in noticeable scarring, which is a significant advantage. However, it's worth noting that the procedure itself can be somewhat challenging to perform. It does require a very high level of skill from the physician, making it one of the more difficult procedures. So, following the initial symptoms, we frequently employ mural eye drops, which are essentially saline solution. The saline solution works by osmosis to draw water out of the cornea, which helps the epithelium adhere quite firmly. We use these eye drops and protective contact lenses for treatment, and while it does improve, once the lens is removed, the corneal erosion can recur at any given moment. In this patient's case, after using the YAG laser, there are no scars. It's so clean that it's hard to tell if the procedure was done. However, it came back again, so we did stromal puncture on the entire area, avoiding the center. You can see it looks a bit hazy here. It doesn't really affect your vision. The vision improved from 0.8 to 1.0, and the corneal erosion healed. In this particular patient's case, if you actually flip the inside of the upper eyelid, you can observe some bumpy papillae, which look somewhat like little pebbles on the inner surface. So we believe it's an allergic reaction, and when those little bumps that are like pebbles are on the inner surface of the eyelid, they would certainly cause a significant amount of friction whenever you blink your eyes. We believe that this is one of the primary causes, and as a result, we administered a steroid injection inside the eyelid. Consequently, we treated the affected region to alleviate the underlying condition and facilitate the formation of an adhesion complex. My sincere hope is that this comprehensive treatment will prevent any future recurrences for a considerable duration. So, regarding recurrent corneal erosion, besides the current treatment approaches, especially if it recurs widely in the central region, a really effective method involves using an excimer laser, referred to as phototherapeutic keratectomy, to essentially remove the corneal epithelium and completely remodel it, quite similar to what's done in LASIK surgery. However, none of these treatments can guarantee 100% prevention of recurrence. This means about 2/3 prevent recurrence, but 1/3 still recur even after treatment. However, compared to just using medication and such conventional treatments, these methods certainly have a degree of effectiveness in preventing recurrence. So, for those of you who keep experiencing this recurrence, please do not lose hope. If you receive proper treatment, good results can be possible.
Cortex vacuum 450.
Yes, it turned out very well. If you trust us and visit, we will do our best to provide excellent care. Thank you.